Hi, I'm Dr. Chad Duplantis from Fort Worth, Texas. My practice focuses on aesthetic and restorative dentistry, and I'd like to provide an expert tip today on the use of technology, especially a scanner in the office. When I think back upon the years that I've been practicing, which is quite a few now, I look back on all of the additions that we've made to our practice, and try and look at the ones that have made a profound impact on the way that we practice dentistry. Out of all the additions we've incorporated, I would say that the gateway to technology was through a digital scanner. And I think that digital scanner has really had a profound impact on the way that we practice dentistry, and also have made some of our workflows a lot more efficient. When I first purchased a scanner, I thought that would improve our restorative workflows. I would be able to provide same-day dentistry or indirect dentistry to our patients. And I also thought that we may cut down on some of our lab bill costs as well as our impression material costs. However, throughout the years, with the changes in technology and some of the features that have been incorporated into the technology, a scanner has become so much more in our practice. In dental school, we were taught that every single patient that comes through our clinic, we should take diagnostic models, turn those into data that we can use to properly treatment plan these patients. When we got out of dental school, we realized that that wasn't necessarily an efficient way of doing things. Taking the impressions was time consuming, it was inconsistent at best, patients didn't really like to have the impressions taken, and then pouring the impressions was a whole other story. With a digital scanner, we've incorporated that into our diagnostic workflows, and we're utilizing them in hygiene and in our new patient visits. So the new patient comes in, we take a digital model in about 2 minutes. We use the data from that model to adequately diagnose and treatment plan that patient. And in addition, through the iTero scanner, we have a feature called time lapse, which allows us to take data sets at periods of time throughout the treatment of that patient and then superimpose those data sets so that we can see both additive and subtractive changes in the dentition and surrounding tissues. In other words, we can treat these patients and see, or we can take these models and we can see abfraction, abrasion, resistance, wear, malalignment, inflammation, recession, and so on and so forth. And with all that data that we accumulate over time, we can make informed treatment decisions on those patients. We can also use that data to educate our patients. By educating our patients and utilizing this data appropriately, it leads to increased case acceptance, which leads to increased productivity, which in turn leads to increased profitability in the practice. And I think that a scanner is something that everybody should have in their practice to be able to adequately and properly treatment plan and treat their patients throughout the life cycle of the patient in the practice. Thank you.